new mobility data we wanted to share with you, and we wanted to also update you on the status of our modeling around the next few weeks and what we are anticipating based upon the good work that's been done by millions of Californians to help bend the curve, and what that modeling foretells in terms of the future and how we continue to navigate in the short term and some of the strategies and thinking in the medium and long term. I'll start by asking Dr. Galley to come up, who will share some of this open-sourced mobility data that we have been receiving on a daily basis that really tracks in a very private way the aggregated data around movement throughout the state of California. It really gives us a good sense of how effective our stay-at-home order has been and how extraordinarily impactful all of you have been in terms of your practicing physical distancing. And you'll see from that mobility data, as he shares it with you, county by county, how that's impacting our larger trend lines and how it's impacting our modeling in very, very positive ways. It's also going to be a cautionary tale because if we pull back from that effort, you can see numbers that will change radically and quickly. And so I want to just caution everybody through this presentation to consider, again, the success of your actions to date and the imperative to maintain that status and continue to stay the course. But first, let me bring up Dr. Galley, and we'll begin the presentation on some of the interesting data that we're now collecting in real time, county by county.
Thank you, Governor. It's a real privilege to be here again to share with you some of the really strong work that Californians are doing together. It's really a privilege to be part of California and knowing that 40 million strong, we are coming together to fight COVID-19, and we are making great progress. But as the governor said, I share the information with you with the caveat that it really does depend on us continuing to do what we've been doing, which is staying at home, and when we're not at home, practicing strong physical distancing. And I'm going to first walk you through some of the data that we get every single day that really guides our model, that really guides what we're seeing in our actual numbers. This slide here shows you each one of these is a county that you each live in, right? And they show generally the same thing. I don't want you to get bogged down by the little blips up and down, but these graphs show that movement is going down all across California. County by county, we see the similar trend line going from up top to down low as it moves to the right. And what that tells us are people are moving around less and staying at home more compared to this time in February. And the comparison is really to when we didn't have things like the stay-at-home orders, where we didn't emphasize physical distancing, and we knew people were moving around their day as they normally did. And so if we zoom in on some of this, and we move into a specific county, Sacramento, where I am at the moment, you see that over the course of weeks, here, starting at the beginning of March and looking how it compared to the end of February, we see that it was about the same. But over time, and as we implemented different stay-at-home efforts and orders, we see that it has generally gone down, and that this is exactly the kind of data that helps inform us as to whether we need to do something different with our expectations and our directions to our counties and all across California, or whether we stay the course. I want to show you Los Angeles, where my family is, and our biggest county in California, that you generally see the same trend line, and even some consistency here from what we're getting, that people are not just staying at home on the weekends, but even more so during the week. And these are the trends that we want to continue to see across the state that reinforces what we've been doing and how we think about the next couple of slides and what we're actually experiencing in our hospitals today. So I want to remind you and bring back this slide that you'll recognize from last week when I was here with you and telling you, look, we put some of these orders and these directions in place around physical distancing and staying at home because this is what we wanted to avoid. Remember, this low line of 50,000 were the additional beds that we are working to add as part of our surge capacity planning. But unmitigated, that means without any interventions, we were worried that we were going to see something that got close to 700,000 hospitalizations across the state, well exceeding our existing capacity in facilities and hospitals, well exceeding even as we added 50,000 surge beds. And this represents, this part under the curve represents many Californians who would become quite sick and maybe even have the worst outcomes from COVID-19. So this slide shows where we are now. And with our expected impact of the stay-at-home orders and physical distancing efforts across California, we see here on this white line, this is just the reminder from the prior slide that this is what it would have looked like if we did nothing. This area, this blue line here, is sort of the mid-range expectation of what we would have seen. And as it carries out, it would have crossed this line, this horizontal line that shows our surge capacity and what we've been working hard at the state level, at the local level, and throughout all of our hospitals to build capacity. What these dots here, and I'm going to zoom in for you, show is what we're actually experiencing. So it fits within the model because any line within this light blue shaded area fits within our model. We see that we are holding on to the bottom part of the model. That's sort of the better case scenario, what we had always hoped for, but we of course planned for something different. This is a point of pride for Californians that we've done so well with what we've been doing. But I caution you, that this line could easily start to see an upward slope, not like this, but much more similar to something that rises quickly if we lose the focus on physical distancing and staying at home. I also want to remind you that we've been hearing about and reviewing many, many models from across the country, from across our state, from across the globe. And some of those models suggest that California and other parts of the country will have a peak earlier than our projection, which is sometime in the month of May or even later. What I want to show you is on this, yeah. Yeah. So down, sorry, we'll get it right. Here at the bottom part of this, the very beginning where we have our actual data, it was tracking almost identical and on the line that we were planning around. Here, as we get further out, we actually see a trend of even better improvement in the number of hospitalizations that we have in California, and that this is actually signaling to us that our peak may not end up being as high as we actually planned around and expected, and that the difference between what we're seeing today in our hospitals may not be that much different than where we are going to peak in the many weeks to come. So what that tells us is that if we continue doing the wonderful things that Californians have banded together to do, that we may actually continue on this trend and avoid a higher sloped line that we have been planning around. But I want to remind you that it is contingent on us continuing to do what we have been doing very well across California. This is an important weekend to many families. That being home over this coming weekend is of vital importance for all of us. It's a way to protect our communities, protect our neighbors, and protect our families. And I also want to caution that what this data does depend on as well is that we continue to be focused on some of our communities or institutions, skilled nursing facilities as an example, where we know that if we do not continue to be vigilant and focused on protecting the residents and the staff in those institutions, that we may actually see a upward tick in this curve, a number of very vulnerable people who become sick and need to be hospitalized and begin to challenge our current surge capacity. So with that, I wanted to kick it back to the governor so we can talk a little bit more about the efforts we are having to support skilled nursing facilities across the state.
Thank you, Dr. Galley. Skilled nursing facilities continue to be a top priority of our efforts. In fact, some of the first guidance we put out as a state focused on changing the visitation, focusing on making sure that we weren't just monitoring passively the regulatory system that currently supports our skilled nursing facilities up and down the state, but we were providing more technical assistance and technical support to make sure that we keep our patients safe. Let me give you a perspective of what I mean by that. We have 1,224 skilled nursing facilities in the state of California. 1,224, what others refer to as nursing homes in the state. We currently have 191 facilities that we're monitoring because we have patients and staff that have come with the infection, that are tested positive for COVID-19. That represents 1,266 individuals in those 1,224 facilities. So that's a focused area of this administration, of course, of Dr. Galley's work. But that is not the entire picture. Skilled nursing facilities, these nursing homes, are one part of the overall strategy to take care of our seniors and adults in the state of California. There's an additional 7,461 facilities that we also license through the Department of Social Services. These are those small homes, mostly Medi-Cal patients, all throughout the state of California. There's a census capacity just in those homes of upwards of 188,000 individuals that are currently licensed to be supported throughout that network that exists in every part of the state of California. We currently are monitoring 94 facilities in that portfolio, of which 370 individuals, patients, and staff are currently infected. Now, you may consider those numbers and say, well, that sounds relatively modest. You've got hundreds of thousands of patients throughout the entire system. There's 1,266 patients and staff in the SNF system and just 370 in that larger system. But that doesn't give you the entire picture. There have been some appropriate headlines about certain areas in the state of California and specific facilities that have become hotspots, where we have seen a disproportionate number of people have contracted the disease, a number of people that have tragically passed away. And so what we have done, in addition to broadening those supports over the last number of weeks, is we've put out specific new guidelines and strategies that have been backed up by what I would refer to as SWAT teams, individuals, infectious control professionals that are working with the CDC and others to saturate those areas of concern and focus. A few weeks back, I highlighted the concerns we have down in San Bernardino County as one specific example. There are a number of other counties that we're monitoring as well by providing more technical support. We have also trained 600 nurses that were supporting the regulatory system and now are focusing more on technical guidance and not just broader regulatory support of the entire delivery system. And so we've basically put more personnel, more technical assistance, focusing on infectious disease control and really doing what we can to decompress that entire system. What I mean by that is when someone is tested positive or a cohort of patients in these facilities and or staff test positive, that we can quickly identify those individuals, isolate, quarantine, and ultimately trace and track the pattern of the infection. Clearly, there have been some examples where patients have been sent to different hospitals. That is not a recommendation unless they're in acute care needs. These hospitals, for many of our seniors, have their own challenges as it relates to infection. And so what we have now is a different strategy and different protocol where we've identified facilities that we now can place individuals that have either been exposed or have tested positive for COVID-19, and that includes the USNS Mercy. Just today, working with the Navy, we were very pleased, and I want to thank the President and his entire team for affording us the opportunity to utilize the USNS Mercy differently and specific to the challenges within our nursing facilities and nursing homes. They are affording us the opportunity to prioritize that population by using the incredible asset that the Mercy provides us. This will help decompress the system. These will be for non-COVID positive patients. I want to make that clear, but nonetheless will allow us to concentrate those that are positive and again, decompress those that are not into these other sites. In addition to that, we have identified 7 specific sites that allow us hundreds and hundreds of beds that will further that cause outside of the USNS Mercy. But I just giving you an overall sense of the seriousness to which we place our efforts and focus on protecting our most vulnerable, our seniors in the state of California, and protecting this remarkable system that has been built up over the course of years. As some of you who have followed the state of California and some of our efforts, this is one of the top priorities for this state, and that is preparing for what some have referred to as the golden wave in the state of California. This state has a disproportionate number of aging and graying individuals, and we have a unique responsibility to take care of them and take care of their caregivers. We put together a master plan for aging, an incredible task force, including a subset of that with former First Lady Maria Shriver to focus on dementia care and Alzheimer's care. They have reports that will be coming out very shortly guiding our larger efforts, and that is encouraging. But beyond that, we have to obviously address situationally on dealing with the needs of those that are dealing with the unique challenges of COVID-19. And so I just want folks to know we have some short-term strategies, but we also have a longer-term vision that is being prepared and advanced at the same time. I want to just also make a point, and that is we, again, not only have individual patients that have tested positive, but as I said, staff. And to that end, I want folks to know what we're doing for our staff. We are doing more as it relates to accommodations. We talked yesterday about a new site that we put together where we're providing free hotel rooms or deeply discounted hotel rooms for healthcare workers. By the way, we had over 150 calls within the first few minutes of that announcement yesterday. But we, in particular, are focusing on our LVNs and our CNAs. And we want to go beyond just the hotel accommodations. We are also providing stipends. We're making available $500 stipends for our workforce. Many that are struggling, again, to feel comfortable or confident going home, even to take care of their own families because they feel like they can infect their families. Many staying not just in hotel rooms on their own dime, though no longer, but also many that feel like they have no other place to go but in their car where they're spending the nights. And so this is part of that Facebook money, the $25 million that Mark Zuckerberg announced, and we are really honing in on focusing those dollars specifically to the LVN and the CNA population to really help support them. They're the backbone of our nursing facilities. And these are not the most highly compensated, but they are among the most highly competent of our workforce, and they deserve enormous amount of gratitude, but also support at this critical time. In addition to that, we are making calls in an unprecedented way. When I say we have hundreds of people, it's not an exaggeration. 15 field offices every single day are calling every single nursing facility in the state of California. Let me give you a proof point. Quite literally this morning, I was handed the information that they had conversations with 1,030 skilled nursing facilities, two-way conversations just yesterday. And they're making the calls for those that haven't returned those phone calls. And they're not just checking calls. They're not just asking how many positive patients or staff members. It's about support, what you need, including the creation, not only, as I said, of this task force, or rather this specialty SWAT team, but also temporary staffing agencies that we are now engaged with to help with the crisis of staff that are not able to come to work because they feel they've been exposed or have tested positive for COVID-19. We've read some headlines about that. We've got now these temporary staffing agencies that can help support those efforts, and we don't want to react to that. These phone calls allow us to be proactive and anticipate those staffing needs in real time. We've also developed new partnerships with our hospitals, again, in the SNF area, in these nursing homes. These already have strong linkages to our hospital system, but we are strengthening them even further in terms of making sure we're doing more televisits and more on-site visits, working with our partners in our hospital system as well. So forgive me for being long-winded, but this is a point of passion, as it should be for all of us, to care for our elderly, care for the people that literally raised us and took care of us. This is the greatest generation. This is a generation that not only won wars, but built the world's largest and most vibrant middle class that we need to protect, and we need to be there for them at their time of need. And so that's an update. Very good news with the Mercy. Very proud of the team and their incredible work as it relates to reaching out to these facilities. One positive is too much, and certainly these hotspots of concentration are points of concern, but also, again, points of emphasis in terms of how we're responding and how we're approaching. I want to make one additional point, then update you on our daily briefing and numbers, and then, of course, bring back Dr. Galley to talk more about the modeling. I imagine there'll be more questions about that and potentially more questions about our efforts for our seniors. But here's some really good news. In addition to the USNS Mercy now taking seniors on board and helping us decompress our nursing homes in the state of California, we also got word with our partners at FEMA, and I cannot speak highly enough of Pete Gaynor, and Bob Fenton, his regional director, Gaynor, the acting director of FEMA, first in the nation. And I always am proud to say that. We were inspired by the work of Kat Taylor and the Currys, Steph Curry and his wife, in Oakland, California. A few days ago, got attention, deservedly got attention for trying to do two things at once: meet the needs of seniors, but also address the crisis with our restaurants that are struggling, so many that have closed, and the unemployment and the economic impact that has created. They inspired a conversation with FEMA that leads to this announcement today. FEMA is going to help support the delivery of significantly greater number of meals for our seniors that are isolated at home. And why is that important? Because Meals on Wheels alone can't do what is required to protect and meet the needs of our seniors. Just 50,000 meals. It's an extraordinary number that Meals on Wheels is able to procure every single day. But we have well over 1 million people isolated, not just in the SNFs, not just in these other adult and senior facilities, but isolated at home. Seniors that cannot prepare their own meals and clearly are not prepared to get the kind of support that many of us provide for ourselves when we go to the grocery store. Many with mobility issues, many simply unable to fend for themselves. This has been a real concern for us. And because of the incredible leadership of FEMA, we are able now to partner with restaurants and begin to procure 3 meals a day of nutritious food. And by the way, I say nutritious, not because I want to be paternalistic, not because I want to moralize, but because it's incredibly important for our seniors to get nutritious meals that have less sodium, sugar, and the like. And so we have guidelines and we'll help support our restaurant workers to deliver 3 meals a day to exponentially expand our capacity to meet the needs of our seniors all throughout the state of California, inspired by the Currys. And here we are, just days later. I'm inspired by FEMA's response to this. It's prescriptive, as always with FEMA, and appropriately so, to those that have been impacted directly, either exposed or have tested positive for COVID-19 or exposed to COVID-19, and or simply cannot get the support of Meals on Wheels or even get the kind of support that they need from traditional social safety net programs like food stamps. We call it CalFresh here in the state of California. But again, this is a big deal and will have profound impact on seniors and their needs, as well as the needs of our restaurant industry throughout the state of California. So with that, I want to just ask briefly that Dr. Galley come up and just explain a little bit more about the work that he's doing and his team is doing at our assisted living facilities, our nursing home, our skilled nursing facilities, and the like. And then I'll come back and then give you the update on our daily numbers and where we're tracking and how that model is being impacted by yesterday's numbers, death numbers, and the like. And again, we'll answer any questions right after that. Dr. Galley.
Thank you, Governor. And the Governor did a tremendous job highlighting many of the efforts that we've had from the beginning of our focus on COVID-19 around our skilled nursing facilities, nursing homes, and a number of other congregate care facilities for seniors and other vulnerable populations across the state, in addition to the great work of really reaching out proactively with the facilities across the state, more than 1,200 skilled nursing facilities. We also are committed to providing essential parts of PPE so that the staff who come into those facilities each day can feel protected, both themselves and that they don't spread infection to residents of those facilities. And in addition, there is a focus with our testing task force that we prioritize bringing tests to skilled nursing facilities so that we can identify people with symptoms who might be COVID positive early, make sure that we take care of those individuals in a compassionate but immediate way, as well as testing others before maybe they have symptoms so that we can take care of them well. So together, these efforts, plus the ones that the Governor outlined just a moment ago, really strengthen our ability to wrap around our vulnerable seniors, make sure that we're doing all that we can to support them and communicate with their families. Right? Being able to tell a family member how they're doing. We're increasing our effort to work with our skilled nursing facilities and make sure we have a communication bridge so families can get the messages and know that their loved ones are safe. And when they're showing signs and symptoms, that we can communicate that as well. We understand that this is a hard time for families that want to be able to reach out regularly and visit loved ones, and the fact that that hasn't been happening for weeks is distressing to many, and we want to make sure that we increase communication so families are not in the dark on what's happening. So together, all of these efforts, we hope and believe, will help us galvanize our focus around skilled nursing facilities, and as I mentioned when I was discussing the model, county by county, number of these facilities, and we are watching them closely because we believe even as communities do great work on social distancing and staying at home, that the vulnerability of the residents in these facilities is a top priority for California, not only to protect them, but also to ensure that the hospitals don't have more patients that they need than they can handle at this critical time.
I appreciate, Doctor, you bringing up families, and I also want folks to know that we are putting out $50 million in an emergency appropriation to help with child care. in and around these facilities, and for the frontline workers to also make sure they're taking care of their own families as they take care of our families. And I want to thank the leadership, the Speaker and the Pro Tem for their direction and guidance and counsel, the feedback from the caucuses about the importance of these pop-up child care facilities. This $50 million that we're distributing today should go a long way to advance that. Let me give you updates briefly. Sadly, we have 541 families that have been torn apart due to deaths related to COVID-19. That represents about 49 individuals more than the numbers we put out yesterday. Some 19,472 individuals, 19,472 individuals have now tested positive for COVID-19 in the state of California. Some 2,897 are in our hospital systems and 1,145 in our ICUs. Let me just pause the ICU number. ICU number at 1,145 represents a 1.1% increase from yesterday. Remember yesterday's decrease, 1.9%. This is a modest increase of 1.1%. I said one data point doesn't make a trend line, certainly not a headline. Again, I caution people, even 2 data points don't either. But when we are in single digits, low single digits, that's a very good day. Though, again, for those that are in the ICU, our hearts go out to you. Let me also express, in terms of my heartfelt appreciation to those that are looking forward to spending more time with their family this Easter weekend, Good Friday today. I just want to express my appreciation for everybody that has different plans than they've had perhaps their entire life on how one really reflects on a day like today, a weekend like we're going to have this weekend. Let us continue to stay the course. As I said, these numbers that Dr. Galley that laid out in terms of the modeling, that's a very optimistic model as it relates to the current trend lines. I say this all the time. It's a mantra, and forgive me, I'll repeat it. Not only is the past not equal the future, but we also have to recognize that we are not just along for the ride as it relates to experiencing the future. The future happens inside of us. It's decisions, not conditions, that will determine the fate and future of this modeling. It's your individual decisions. And I know we all have temptation. I get it. I've got 4 kids. It's Easter, and outside, I think Christmas, this is their favorite weekend of the year. It is also one of the most anxiety-inducing as a parent because, like Halloween, there's some side effects to the kind of things that we provide and make available on Easter Sunday to our children. That said, I know all of us are developing some anxiety and cabin fever and want to get out. The weather is improving throughout the state of California. Let's continue to hold the line, and let's just do this together. Give us a few more weeks to see where these trend lines go, and then we'll be talking a lot more. And I imagine there may be a question or two. I just want to caution you before you ask the question, well, what does this mean in terms of when we can go back to some semblance of normalcy? We have detailed strategies that we're working on that we're very close to making public. So know that we are as deeply eager to provide you that information as you are to receive that information about how we can go back to the way things used to be with the kind of heightened vigilance that is required of this moment before there is a vaccine and the kind of herd immunity that puts COVID-19 into the record, or rather history books. But nonetheless, that will be fundamentally determined on the basis of your individual behavior. No one can impact this more than you. No one can impact this more than you. I'll repeat that again. Your decision will determine what the state and the federal government do in this respect. And so I cannot impress upon you more to continue to do the incredible work that you've done practice physical distancing, wear appropriate face coverings when you cannot, when you're out there for essential work or essential grocery shopping or medical supply shopping, and really protect yourself and protect your loved ones this weekend by not going back into environments where you're mixing with people and you can't practice that appropriate physical distancing. So with that, of course, always happy to answer a few questions.
Alex Michelson, Fox 11.
Hi, Governor Newsom. You have talked a few days ago about the issue of mental health, and I'm wondering if you can talk to us more about what you've heard in terms of feedback since having those hotlines open, and also what advice you found to be particularly helpful for you in terms of keeping your own mental health up during this extraordinary crisis.
Thank you for the question, and I'm not just saying that blithely and flippantly. Thank you for the question, because it's incredibly important while we have these stay-at-home orders to remind people you're not alone, that we have resources available to you if you want to talk to someone, you just want to hear someone else's voice. We have the resources to do that. We have a covid19.ca.gov website that lays out those resources in a very culturally competent lens, which I mean nothing more than this. For LGBTQ community, we have a resource guide. For seniors, we have resource guides. For our adolescents, we have resource guides. For our teens, teen crisis line. But nothing more important, just to answer pointedly your question, than asking for help, reaching out and saying, you know what, can I just spend a little bit of time talking to you? How are you feeling? Listen to me a little bit, just have a chance to hear me out, compare and contrast. Again, I said this yesterday, the toughest people I know, the strongest people I know are people that ask for help. The toughest and strongest people I know, the most successful people I know, focus not just on their physical health, but focus on their brain health, focus on their mental health. They ask for help. Please reach out, ask for help.
Angela Hart, Kaiser Health News.
Thank you, Governor. I wanted to ask you about, given the early progress you just discussed, there's been a lot of discussion across California about how impactful these early shelter-in-place orders have been. I wanted to ask you how much credit you give to those early shelter-in-place orders, and specifically those Bay Area health officers who really took that first action across the country.
Huge credit. They've been incredible leaders. I give a lot of credit to Dr. Galley and his team that put out some early guidelines, first stay-at-home order for our seniors 65 and over, all 5.3 million of them. But the county health directors have been fantastic. Local elected officials have been fantastic. Leadership across the spectrum, across the board.
John Myers, LA Times.
Governor, I want to ask you about Easter Sunday in particular, because there are reports from a few locations, specifically in the Inland Empire, that there have been arguments about allowing Easter services to continue, what kind of social distancing can be done. There was a lawsuit threatened against San Bernardino County. Apparently San Bernardino County now is offering guidance about drive-by or drive-through kinds of ceremonies. What is your advice to these local leaders in any part of the state about Easter services? And then also, have you been in contact with any local leaders about this as these issues and these challenges have come up?
Yeah, I mean, practice physical distancing. It applies to everyone across the spectrum. It applies to faith communities. It applies to you, me, everybody. So as I said the other day, as you pray, move your feet at least 6 feet apart from someone else. I think it was John Kennedy who said in his inaugural, God's work on earth is truly our own. It's faith and works. So practice your faith, but do so in a way that allows you to keep yourself healthy, keep others healthy, and does justice to the teachings of Christ, God, and others. And so we maintain that very strongly as our guidance and direction. And forgive me, The cautionary tale, there's many of them all across the United States, not least of which just nearby where I'm speaking, where members of one church, tragically, disproportionate number, came down with the virus because they were continuing to practice their faith in a way that did not serve God or each other and put the entire community at risk.
Becca Haberger, ABC 10.
Hi. With the number of unemployment rate going up and people applying for unemployment, how is EDD dealing with the huge spike in incoming phone calls? Is there going to be more people added to the phone lines to work them?
Yeah.
Can EDD open up their phone lines longer than noon? What are you suggesting for them to deal with this new growing number of people trying to call their phone line to get the money they need to survive during their unemployment period?
Our top priority has been on processing these claims, and it's a remarkable thing. I can still say this, but I caution, I say this, and a week later, we see a backup, but we're still within that prescribed period of time that we had before this crisis to get checks out, and that's within 21 days. They still report in. Today, Julie Sue said it again. We still believe we can cut those checks within that traditional timeline, despite this unprecedented surge of requests and applications. And that's because she has reprioritized over 550 staff just to focus on that. We have hundreds more staff that are also now being reprioritized to answer the second part of your question, and that is to expand the hours of our call center. Since 2013, our call center at EDD has gone from 8 a.m. to just noon. We're now expanding those hours. I have directed her to do at least till 5 o'clock, 8 to 5, but we believe we have the capacity to go even further. Until further notice, we at least have the new expanded hours happening very shortly. Hundreds of additional personnel are being redeployed to make that happen. Also want to remind you and others that the $600, there's been a lot of questions about this, the $600 federal checks, that 4 months of additional support from the federal government on unemployment insurance. We are able to distribute those checks starting on Easter Sunday. So those first checks will start going out in addition to what you're entitled to under California's unemployment claims. And I'll remind people that those claims, depending on your income, are as low as $40, as high as $450 a week, plus the capacity to earn an additional, or at least receive an additional $600 because of that last stimulus in the federal government. And that's just for 4 months. And obviously, we're going to need to work more to see with Congress, the president, to see if we can get that extended beyond the next 4 months.
Ashley Zavala, Cron 4.
Hey, Governor, I imagine being at the State Operations Center, this is in the back of your mind always because you're typically there for a natural disaster or the power shutoffs recently in the fall. I'm just curious what the state's plan is, as is with the COVID-19 conditions with hospitals, in the event that a natural disaster does happen, or if we're in a weather situation that would require a power shutoff. And I know the weather's been favorable across the state for that, but just seeing what the plan would be there.
Well, these guys, we have the best and the brightest. That's not my assessment. I think by any objective measure, there is no organizational structure more effective and efficient than the one Mark Gilladucci has put together at the Office of Mercy Services. These guys have been at the issue of mutual aid at scale, unlike any other state in America, unlike perhaps just a few other nations. The fires in 2015 and 18, 19, and obviously the complications related to PSPS and these power shutoffs just last year. The hand-in-glove approach to supporting local first responders and then having the support of other states and their first responders. So all that planning continues. That's part of our daily brief and update, not just on COVID-19, but all of those plans. I mentioned yesterday may not have been picked up by many individuals, that we have National Guard men and women focusing now on vegetation management and forest management in anticipation of this fire season. So we are deeply, trust me, I'm very focused on the upcoming fire season. So is our entire team. And as you know, the last few years, we've been able to significantly increase the total amount of assets, not just the human assets as it relates to firefighting capacity, but new suppression technologies, and that's the ability to get new radar and LiDAR support, satellite support from the federal government, additional suppression through the procurement of new technology, these new C-130s that are finally starting to come in, these new helicopters that are coming in that ultimately will allow us nighttime suppression capacity, all those new cameras that we put in place all throughout the state of California. And remember, forgive me for extending a response to your important question. Remember that all the work we did with PG&E in this bankruptcy was predicated on completely reimagining a safety-first culture. And all of that work was predicated on prescriptive responsibilities that PG&E has to substantially increase their public safety efforts and do so before June 30th, if indeed they are going to emerge from bankruptcy. All of those things we are monitoring through the Public Utilities Commission. We will hold them to account, and we will hold ourselves to accountable to do what we do every year at this time, and that is to prepare for all hazard response. That includes not just fires, floods, but yes, earthquakes.
Kathleen Ronayne, AP.
Hi, Governor. 2 questions for you. So first of all, Apple and Google today have announced a joint effort to help public health officials contain the virus by using, Bluetooth technology so that people can know if they have been in the vicinity of someone that is positive for coronavirus. We're already using some mobility data that I believe comes from cell phones. Do we have plans to use these new digital contract tracing tools as a means of, deciding who can go back to work? And then the second question would be, you talked a little bit today about how our situation is improving in the state, obviously with caveats. But if this trend continues, when does the planning begin for a gradual reopening of things?
As I said in my opening comments, I anticipated that question, the latter part of your question, and know that we are putting together detailed plans to architect what that looks like. And those will be made public very, very soon. Just know that work is being done, but work continues to need to be done by you and others to allow that work to be meaningful, meaning this is all predicated on individual behavior, continuing to bend that curve, mitigating this peak and the acuity of a peak, and making sure that we reduce the transmission of the virus, which goes to the first part of your question. Not only are we well aware of the announcement that came today, already we have engaged those companies. We were on the phone just this morning, for example, with Apple specifically on that tracing technology. So the answer is yes, and we look forward to continuing to build that capacity and partnership, and that is also part of the planning exercise as we see some light and we see a future where we're not all permanently in this current state stay-at-home order.
Elizabeth Aguilera, Cal Matters.
Hi, Governor. I also have a 2-part question for you. The first one being that nursing homes, which you talked a lot about today, nursing home leaders have asked the administration to get, avoid sending recovering COVID patients back to their nursing homes to free up hospital beds. So can you explain a little bit what your plan is related to what you talked about today to open recovery centers or designate certain nursing facilities, to protect the other residents in those homes who have not tested positive? And then secondly, if there's any information you have regarding once you have bodies, cadavers, do they carry the virus, and is that changing how bodies are dealt with, or guidance for funeral homes who are then in charge of working with families?
I pride myself on being briefed on many things, but I've had body bag conversation, but not cadaver transmission conversations. And that's why I'm very proud to have my doctor to my left, who now will come and talk to you about that.
So it's a great question, and I think one that we don't have an answer to yet. We are obviously working to make sure that any deceased bodies can be appropriately handled, so we don't have bodies at hospitals longer than we need, or typically, that they can move to morgues and families can have the appropriate or typical ceremonies to celebrate and honor those who have passed away. We know that this is a very important issue. We know that a lot of our mortuaries are asking the same question, and we're working with our laboratories, with our coroners, to determine whether the cadavers carry the virus or not, but we do not have that information at this time.
Maybe that's why I wasn't briefed on that. Let me also just make a point that I neglected to make a moment ago. In fact, was anticipating that's where you were going, the first part of your question on the decompression strategies related to the skilled nursing facilities, our nursing homes. I talked about specifically USNS Mercy and how that will be part of that decompression strategy. We also have identified 7 specific facilities that will also aid in that effort, again, in addition to the USNS Mercy. And so that's, I hope, a little bit more specific response to the first part of your question. I also want you to know that we just sent an additional 200,000 glove sets and 200,000 sets of masks to our nursing homes in these hotspot areas to address some of the PPE anxiety that we know is very real as well. Just in addition to the larger cash that we send out there, we recognize still many of these facilities are running short of what they deserve as we again anticipate the arrival of tens of millions of N95 masks and other surgical masks over the course of the next few weeks from the purchase orders that we have placed based on the announcement we made a couple days ago.
Final question, Marissa Perlman, CBS 13.
Hi, Governor. 2 questions for you.
Everybody's got, you're all getting smarter. Everybody's got 2 questions. I'm on to you guys, but I appreciate it.
Well, with more than 2 million unemployment claims, how many people have gotten money so far? And then second, we've heard about, plans for adding patient beds. We're only aware of about the 400 beds in the Sacramento area that have been added. When it comes to our hospital systems like UC Davis, Sutter, Dignity, and Kaiser, can you say yet where else the thousands of beds you've been talking about will go in this area?
Well, we put out the detailed plans on Porterville, Fairview. We put out the plans in San Carlos. We put out the plans here at the Sleep Train Arena and the 400 beds specifically there. As you know, I put out detailed plans of where the 8 FMS 2,000 beds and those 8 FMS sites are all throughout the state of California, including north of Sacramento, around Butte and Shasta County, Fresno, Riverside, all throughout the state of California, not just along the coast and the larger urban centers. Again, we specifically identified, in addition to those beds and those alternative care facilities, what we're doing at St. Vincent and Seton here in Northern California, and what we are doing to identify additional surge capacity with our dormitories and the UCs and CSUs, which include some that have been identified specifically in this region in Northern California, in the Sacramento County area, in addition to all the hotels. By the way, 8,858 now hotels also have operating agreements in place that are also part of those strategies, just giving you an update on the efforts around homeless individuals. So all of that is part of the portfolio, but I'm happy to provide you that in more detail and also provide you the first part of your question, the answer on how many of the 2.5 plus million, now 2.5 plus million unemployment insurance claims that have been done just since March 12th, how many checks have been cut. I'll make sure a member of our team gets back to you on that as well. Let me just continue to remind all of you to practice physical distancing, to continue to do the extraordinary work you have done. We collectively as a state to, yes, forgive me, meet this moment. Let me encourage those of you that in the spirit of Good Friday, in the spirit of this weekend and Easter, that want to contribute time and energy to our food banks, to reach out to our Cal Volunteers team, continue to consider whether or not you are in a position to contribute a little bit of energy and time beyond just our food banks, to volunteer, to help those in needs, to check in on our seniors, and to provide the kind of mental support that are needed of this moment. We have all those websites up, but none more important than just remembering this one, covid19.ca.gov. Take care, everybody, and happy Easter.